Thank you for joining us as Monroe County Schools presents Making Educators Partners in Youth Suicide Prevention. This training was developed as a result of the Jason Flatt Act, House Bill 198, which requires annual suicide prevention education training for certified school system personnel. This training does not turn teachers into counselors, but rather it helps them to recognize warning signs and know how to make referrals for help when necessary. Similar legislation has been signed in 14 states. This Georgia House bill was signed by Governor Nathan Deal in May of 2015. You may ask, why is suicide prevention training important? Please take a moment to view this public service announcement entitled Empty Seat. Suicide prevention is important because 7 in 100,000 youth ages 15 to 19 die by suicide each year. 1 in 100,000 children ages 10 to 14 die by suicide each year. Suicide is the second leading cause of death for 10 to 24-year-old Americans. 2,756 children and teens ages 0 to 19 died by suicide in 2019. For every suicide death, there are between 50 and 200 attempts. 116,211 self-inflicted injuries for teens occurred in 2013. 18% of high school students seriously considered suicide, 13% made a plan, and 8% attempted suicide in 2013. In 2019, over 1,600 Georgians died by suicide. 59 youth in Georgia died by suicide between the ages of 10 and 17. In 2019, suicide was the second leading cause of death for 10 to 34-year-olds in Georgia. The responsibility of our staff as it relates to suicide prevention is to understand the importance of your critical but limited role in the identification of students at risk for suicide. Familiarize yourself with school policies and procedures that address this issue. Learn information that facilitates identification of at-risk students. Listen to students verbally and non-verbally for warning signs. Identify those students who may be at elevated risk based on that identification, and then refer those students to the appropriate resources. These resources would include your school counselor, your school administrators, and the Monroe County Schools Family Services Coordinator. Allow us now to define the problem. Attempted suicide is a potentially self-injurious act completed with at least some intent to die as a result of the act. Suicide is an attempt to solve a problem of intense emotional pain with impaired problem-solving skills. Now let's talk about protective factors, risk factors, and warning signs. Protective factors are conditions or attributes, including skills, strengths, resources, supports, or coping strategies in individuals, families, communities, or the larger society that help people deal more effectively with stressful events and mitigate or eliminate risk in families and communities. Protective factors in suicide prevention include, but are not limited to, contact with a caring adult, a sense of connection or participation in school, positive self-esteem and coping skills, and access to care for mental, physical, and/or substance disorders. Some of the risk factors associated with suicide include, but are not limited to, demographics, such as age, sex, gender identity, and race. Clinical, psychiatric diagnosis, drug and alcohol use, or a previous attempt. Family, which might include a history of suicide. Exposure to suicide, either personally or in the media, or through the death of a peer under any circumstance. And then recent severe stressors, including loss, trouble, or some type of change or transition. To learn the warning signs of suicide, we will use the acronym FACTS, FACTS. F is for feelings, A is for actions, C is for changes, T is for threats, and S is for situations. Some characteristics of suicide include, but are not limited to, viewing suicide as an alternative to a problem which is perceived as unsolvable by any other means. Crisis thinking, which colors problem-solving skills. The person is often ambivalent. The suicidal solution has an irrational component. And then suicide can be a form of communication. 4 out of 5 teens who attempt suicide give clear warning signs, which include, but are not limited to, the following: talking about suicide, making statements about feeling hopeless, helpless, or worthless, a deepening depression, preoccupation with death, taking unnecessary risks or exhibiting self-destructive behavior, out-of-character behavior, a loss of interest in the things one cares about, visiting or calling people one cares about, making arrangements, setting one's affairs in order, and then giving prized possessions away. Students who are at a higher risk for suicide often threaten to commit suicide, look for access or means to commit suicide, talk or write about death, dying, and/or suicide, or have made previous attempts that were serious enough to require hospitalization. Here are 3 steps to help students who are at risk of suicide. 1. Recognize the warning signs. 2. Provide support by expressing concern and seeking clarification. And 3. Provide a warm handoff by referring the student to the appropriate resources. Here are some protective factors you can begin to practice that will help prevent suicide. Teach students that it is okay to ask for help. Give students permission to talk about traumatic events like suicide. Help students identify trusted adults. Encourage students to participate in school and community activities. Acknowledge student efforts. Be a good listener as often as you can. Some suggestions that can further help you prepare yourself as it relates to suicide prevention are knowing school policies and procedures, examining your personal attitudes and values towards suicide, and reviewing your curriculum for ways in which you can foster protective factors, including resiliency, assurance, and empathy. Again, remember that your role is to simply learn the signs of risk in students, identify at-risk students, and then refer those students to the appropriate resources. The Monroe County Suicide Prevention Policy, adopted by the Monroe County School Board on August 11, 2015, states that the Monroe County Board of Education shall provide to all certified personnel annual training in suicide awareness and prevention in accordance with state law and rules established by the Georgia Department of Education. The superintendent or designee shall develop procedures to address, at a minimum, suicide prevention efforts, intervention, and postvention. Such procedures shall be developed in consultation with school and community stakeholders, school-employed mental health professionals, and suicide prevention experts. In accordance with state law, no person shall have a cause of action for any loss or damage caused by any act or omission resulting from the implementation of this policy or its implementing procedures, or resulting from any training or lack thereof required by state law or this policy. The training or lack thereof required by the provisions of state law shall not be construed to impose any specific duty of care. Neither the training nor the procedures are designed to impose ministerial duties, but to provide a framework in which educators can exercise their professional judgment in the best interest of students. The Georgia Crisis and Access Line is a toll-free, confidential hotline available 24 hours a day, 7 days a week, from anywhere in Georgia. This crisis program is sponsored by the Georgia Department of Behavioral Health and Developmental Disabilities. It connects callers with a trained professional counselor who can help them get the services they need if they or someone they know are in emotional distress or a suicidal crisis, or have other problems with mental health, drugs, or alcohol. They will assess crisis situations over the phone and have a mobile team that can go out and do a face-to-face assessment as needed. They can get someone into an inpatient setting quickly and also have vacant appointment times at their disposal to fast-track someone into the community mental health system as needed. We can all help prevent suicide. The National Suicide Prevention Lifeline provides 24/7 free and confidential support for people in distress, prevention and crisis resources for you or your loved ones, and best practices for professionals. Please contact your school's principal and/or counselor immediately if you have concerns about an individual who may be contemplating or attempting suicide. Please take a few minutes to complete the Google form following this video. And thank you for completing this suicide prevention education training. For more information, please contact your school's counselor.